Half of what you'll learn in medical school will be shown to be either dead wrong or out of date within 5 years of your graduation. The trouble is that nobody can tell you which half. So the most important thing to learn is how to learn on your own. Welcome to Problem-Based Learning. I'm Suzanne Lippert, Clinical Assistant Professor in the Stanford Division of Emergency Medicine. I completed medical school at the UC Berkeley-UCSF Joint Medical Program, where I was introduced to a style of learning that truly represents an answer to the challenge raised by Sackett, to learn how to learn. And I'll add, to learn how to think like a doctor. Specifically, as we learn the core concepts of medicine, we will also be learning how to apply your new knowledge in making clinical decisions and practicing skills that will help you excel in clinical settings and throughout the evolution of your career. How to identify what you know, what you don't know, how to query the incredibly vast amount of information that is accessible to you, and ultimately, how to interpret and integrate knowledge into complex systems of medicine.
My name is Amin Azam, and I'm a faculty member of the UC Berkeley Joint Medical Program, or JMP. At the JMP, we answer this question using an approach called problem-based learning, or PBL, where we use patient cases to provide a framework from which medical students learn medicine, and in Suzanne's courses, emergency medicine in particular. PBL has been around in medical education since the 1960s, but in the modern, digitally interconnected world we live in now, it has renewed relevance to today's learners and educators.
Okay, we have a big goal. How do we actually get there? What is the structure and flow to this type of learning? We have enlisted the help of our JMP colleagues. These medical students are experts in PBL. I've asked them to describe and demonstrate the process of PBL so we can begin our first day of class by diving into a case. Let's talk with the students and watch them as they begin the 2-day process of working collectively through a case, defining the content they will choose to pursue and learn together on day 1, independently researching that content, and returning on day 2 to teach each other what they have learned.
This is here.
Oh, great.
Good.
Hi.
Hi.
Hey.
Okay.
Cool.
All right, so we're all here. It's about 8:30, so you want to start?
Yeah.
Okay. I'm going to facilitate. I sent an email out with all the roles, but just to go over them. So do we have a scribe?
Yes.
Okay, great. And a timekeeper?
That's me.
Okay. LOLI writer?
That's
okay.
me.
What were you doing?
We're researchers.
Okay, great. Okay, I'm going to hand out the case, and then Liz, will you read the first page for us?
So the scribe is usually somebody who is either scribing on the board or taking notes on the computer. In my experience, it's always been on the board. And so basically this person is just jotting down all the ideas that flow from our discussion into categories on the board and really helping to diagram our thought process.
Mr. Douglas is a 73-year-old man brought in by ambulance for altered mental status.
The researchers are really important. They really help us to kind of reflect on the learning issues that we develop and certain questions that we have. For example, if a particular drug comes up in the case that we don't really know, the researcher can really quickly identify what class of drug this might be.
Upon entering the room, you see a lethargic elderly gentleman with a falling lesion on his leg.
All right, so do we want to come up with a problem list and then maybe a differential?
Yeah, sounds great.
Sure.
Okay. What are some of the problems?
So when you're the facilitator of the group, that means you're keeping everybody on board and on track with what we're doing in the case. I think the facilitator is not necessarily the most vocal person in the group, but they're the person that is really attuned to the process and make sure that everybody is really invested in the case, that people's voices are heard equally.
Sounds good. Great. I made a spreadsheet for all the LIs that we come up with, so just give me a heads up when you want me to write something. Cool, thanks.
And how long do you want to spend on this page?
Okay, how about 5 to 6 minutes?
Okay.
Sure. Okay.
The timekeeper basically is helping the group adhere to the time contract, making sure that we're not spending too much time on one particular page or one particular issue that we're dealing with.
The discussion of what responsibilities are important to delegate in itself has been an incredible learning experience. Within those roles, you're learning very concrete skills. So as a facilitator, you're constantly needing to have and develop an interpersonal sensitivity as to keeping track of the vibes of everyone in the room and the progress overall. If you're keeping track of time, you have to navigate this social tension of cutting off people when they're really excited about something, or really just making sure people understand that there is a larger responsibility to the group to make sure everything's moving along.
So one of the problems is altered mental status.
Do we all know what that means?
Everyone okay with that? Do we want to, is that an LI?
Let's throw it up there.
Yeah.
I'd be curious about the
Putting it on the
clinical.
list.
Okay.
A learning issue is something that we're interested in researching further once we finish the case for the day. So a learning issue might be a question about, how does this process occur in the body, or it might be a broader topic or a disease. And so basically we generate learning issues throughout the day as we work through the case, and they stem from just people's curiosity or questions about the case.
If you're in charge of keeping track of the learning issues or objects, you're trying to understand in the larger context of the body of knowledge, what's a digestible piece of information? What's an important question? And how can we fit this into the larger picture?
But I'm curious, what the color is, what the texture is, if it's pussing.
Yeah.
Is that a boil? It looks like it's peeling. It's definitely more information to get from that picture.
Everybody's kind of seeing the case from a different angle, so you really get the benefit of getting everybody's opinion and everybody's perspective.
The students will now spend anywhere from 5 to 30 minutes on each page of the case, reading, listing problems, identifying what they already know, and identifying topics with which they are less familiar that can be made into learning issues. This is how students explore the content in the case.
Okay, anything for the differential? Do we think this is something?
So just right away, let's put up that this is an elderly gentleman, so his age might be contributing in some ways. There might be a baseline that we should know about.
But it could be as a result of a trauma to his left foot. So let's put, some general accident or trauma.
Because of the lesion and the elevated heart rate, the hypotension, maybe something like bacterial sepsis.
Okay.
Alternatively, I think with the altered mental status and these vital signs and the lesion, I'm thinking like complications of diabetes.
And can't you get altered mental status if you have diabetes and your sugars are too low?
Yeah, absolutely.
Yeah? Okay, so maybe like for a to-do list, we can check sugars. How are we doing on time?
I think we're running up on close to 5 minutes.
Okay, do we want to move to the next page and then we can, get more ideas as we read more?
Yeah.
Okay.
Initial interventions. You immediately perform the following. Place the patient on cardiac monitor and supplemental oxygen. Insert 2 large bore peripheral IVs. Start IV fluid resuscitation with normal saline. Give rectal Tylenol. And can we just do an LI on different types of IVs?
Yeah, that would be helpful.
Do we all know why a lesion might be the result of a complication from diabetes? Should that be an
That'd
LI?
be great.
Yeah. Okay, so it looks like we have about 8 learning issues. Do we want to put a few more up on the board before we move on to the next page?
Yeah.
Okay.
I was a little curious about metabolic acidosis and respiratory acidosis. It kind of looks like that might be what's going on.
Yeah.
People, does that sound like a good one for people? Okay.
Yeah, that sounds good.
And just on the topic of diabetes, I'm really curious about type 2. Because I haven't learned about that in depth.
And so the learning issue is something that we want to investigate further, but we feel like it would take more time than we have that day. And eventually at the end of the day, we're going to divide them up between our group members, and different people are going to research these learning issues and bring back what they've learned to the group.
The students refine and divide the learning issues. Each student on the team is responsible for researching and preparing a brief teaching module and written summary on their assigned topic. This teaching module and written summary is called a learning object.
All right, guys, so we have a pretty long list of things that we're curious about. Shall we try to refine them and come up with a shorter list? Yeah? Okay. Mental status, we have some derm things, we have some stuff about sepsis, and then some endocrine things.
I think sepsis.
The sepsis stuff? Shark stuff?
I second
Okay.
that.
What is sepsis, and maybe how's it? What are the criteria for diagnosing sepsis?
Okay, what is it?
I'm really curious about acidosis. I don't know if you guys want to learn more about that.
Yeah.
Okay.
And I'm not sure if we should focus on metabolic or respiratory.
Probably just focus on acidosis and then have the person who's doing the research kind of suss out if they want to do just one or do both as they kind of learn a little bit more about it.
And definitely at least distinguish between the two.
Between the two, okay. So it looks like we have a pretty good list. Let's go ahead and choose who's going to take which LI.
I really like the day in the life one.
Yeah? Okay. So Lini, you'll do this one.
I'll take the acidosis.
You'll take the acidosis? Yeah. Okay, Rachel. And I'll go ahead and take sepsis. Seems like a pretty good one. And I will write these up for everyone and email them out, and then I look forward to hearing your presentations and reading your LOs.
A learning object is basically the condensed version of your learning issue, or LI. I'll look at different textbooks, either online or at the school library. Then I can also use PubMed to look at different research papers and look at the published work on that topic, and then basically condensing these ideas into a short, maybe 4 to 6 page document with some diagrams, pictures, and text that would really help clearly and concisely explain what I've learned to my classmates. The idea is not really to just regurgitate the information you've learned, because oftentimes it's too much information. The idea is really to make this easily understandable to other people who didn't research your LO, and then be able to present it in a short, about 6 to 8 minute presentation to the class.
I think the most important thing for day 2 is for everyone to come prepared. And when I say prepared, I mean having read through everyone else's LOs, either the night before or the morning of, so that you're really aware of what's going on, what knowledge has everyone accumulated, what page is everyone on, what should you come in knowing, so that you can participate and bring forth everything you have to really get the most out of the class.
I think the teaching skills that I've learned through the JMP are really to tailor my teaching styles to the needs of my group, and then choose a teaching technique or style that really serves their needs best is an invaluable skill that I've gained from the JMP, and would really serve me well as I continue on to my future career, where I will have to assess the needs of my patients or the community that I'm working in, and be able to convey information to them in a way that is really understandable for them and really high yield in terms of efficiency and content.
All right, so I'm gonna go ahead and teach this LO. Did you guys all get a chance to read it? Yeah? Cool, okay. And if you have any questions as I'm kind of going through things, just let me know. So there's an image on the first page. It's kind of your money shot. So if you guys can understand the progression from SIRS to multi-organ dysfunction syndrome and death, then you guys have all that you need to take from this LO, okay? So let's talk a little bit about SIRS. What does SIRS stand for? Do you guys remember?
Systemic inflammatory response?
Syndrome, yes. So I want you to focus on the word syndrome. So what that makes you think of is it's multiple things, okay? So the multiple things that it could be, there's a couple vital signs that we want to look at.
I think the most important thing I've learned about teaching through PBL is how important it is to make things fun and exciting and creative for your classmates. Before coming to class, we read these different learning objects, and most of the time they're very similar to what you'd read in a textbook. It's really incredible production. But when you come into the classroom, that's an opportunity to really work with other people and talk about what's going on and come at it in a way that you can only do in an interpersonal setting.
The ability to really work in a team and prioritize what information you want to learn about, and have these discussions and really compromise with group members who might want to learn about different topics is really valuable just in any career.
PBL is certainly teaching me the medical knowledge I'll need, but it's also teaching me about my own brain and about who I am as a learner and as a future physician. And by that I mean that I'm learning how to interact with other physicians and how to interact with myself in these really challenging times of acquiring new knowledge and dealing with illness and clinical encounters that are challenging, and not knowing what the answer is and not really knowing what I'm supposed to do. I'm learning how my brain and my person respond to those situations, and I'm also learning how other people might respond and how I'm going to interact in that as a physician in the future.
We have covered a lot of ground, so let's review. Problem-based learning uses cases to allow students to direct their own learning and develop skills necessary for medical practice. On day 1, students assign roles, work through a case together, and develop robust questions called learning issues. They then assign each other those learning issues, which are essentially questions for further investigation. Students then independently research the answers to those learning issues in order to create learning objects. These learning objects contain the content of the medical knowledge necessary to gain a more profound understanding of the case, and to help your team arrive at appropriate medical decisions within the case. On day 2, students present these learning objects to each other and complete the case. Having experienced PBL as a student and now as a tutor, I continue to find it incredibly engaging. It truly mirrors the critical thinking that is essential in clinical medicine, while also allowing you to actually practice the basic skills of coordinated, team-based patient care.